Our expert panelists joining us today are Dr. Richard Palmquist, integrative veterinarian and owner of Centinela Animal Hospital. He's an author, lecturer, and teacher. Dr. Christina Chambreau, internationally known homeopathic veterinarian, lecturer, and teacher. Joan Ranquet, animal communicator, teacher, author, lecturer, and owner of Communication with All Life University. And Brendan Golia, professional pet trainer, behavior expert, and owner of OC Canine Coaching. Welcome to Smart Pet Talk. I'm your host, Anna DeVere. We have a special guest joining us today, Dr. Neal Sivula, who's going to share his expertise regarding the use of chiropractic therapy for animals. Dr. Sivula is the owner of Dancing Paws Animal Wellness Center and integrative veterinary practice in Northeast Idaho. Welcome, Dr. Sivula, and thank you for joining us today.
Hi, it's great to be here.
Good to have you, Neal. I'm really pleased to get to interview you because you just interviewed me last year, I think.
Yes.
So we can flip it around. I always think that the most interesting place to start is actually how people actually got into the program that they're currently doing. And you've got such extensive credentials. You do so many things that I'm sure your story is interesting. So how did you get into integrative medicine?
Yeah, sure. I had a back injury in high school with football and needed surgery, and I was still having lingering pain afterwards into college and even into vet school. And at least in my area where I grew up, chiropractic really wasn't as popular as it is now, and so chiropractic wasn't really an option. But I was continuing to experience discomfort, and I had a vet school classmate actually who introduced me to his chiropractor, and that's how I got started.
Wow. So chiropractic was your first entry into holistic medicine?
It was. Yeah.
Wow. That's unusual. Usually acupuncture is the entry.
It was acupuncture followed shortly after, but yeah.
Yeah, that's a really common history. That I think unmanaged pain is probably the most common reason why people pursue quote unquote alternative therapies, because they see their conventional doctor and they get conventional treatment and it doesn't succeed. And when it's not successful, then there are these other tools that they then are sort of in pain to reach out for. And so I think that's probably why we're seeing acupuncture progress faster than some of the other alternative modalities into conventional medical world too. Same reason.
Yeah. Now, speaking of conventional medical world, when you trained in chiropractic, did you have chiropractors and veterinarians both taking the course?
Yes. So back when I took the course, there was only the one course at Options out in Illinois. And we trained alongside chiropractors. So that was a big mind shift for me to be able to sit next to chiropractors and talk to them and get that extra philosophy from them during the breaks and, while we were studying. So it was really helpful. Oh, it's very similar. So, that there are over 200 techniques of chiropractic in people now. And so most of the programs that train animal doctors who do chiropractic on animals train a set of techniques that are pretty similar to each other. And then once doctors, maybe if they're a chiropractor and they're used to using certain techniques on their human patients, they may use those on animals. Or in my case, coming in fresh, I did some post chiropractic course training and kind of settled on techniques that work for me. But that was 1999 when I started doing chiropractic, and doctors of chiropractic that work on people, there wasn't that realization that there were doctors trained to do chiropractic on animals. And, it's a lot better now, but it still persists. We'll have clients say that they've talked to their chiropractor about animal chiropractic and their chiropractors don't have any idea about the training and that there are doctors out there.
I'm actually glad you brought that up, because one of the things I had a problem with recently with one of my clients was I wanted her to see a chiropractor for some ongoing care. And she was very opposed to it because she'd had a bad experience with a high force type chiropractor. And she said, God, this guy almost killed me. I can't imagine anybody doing that to my little poodle. She'd break him in half. And so I think maybe for viewers, it'd be really important to talk about some of the really subtle methods and low pressure types of chiropractic to present that reality that chiropractic isn't just maybe somebody really using a lot of force, that you can do really powerful things with a small amount of touch.
And also, while you're addressing that, how do people find out what type of chiropractic the chiropractor for animals or the veterinarian using chiropractic is using? So sort of how do you find it, and what type is it, and what's available? Thanks.
Sure. Yeah. I think as far as the type of chiropractic, that would be a difficult thing, but you kind of get into the weeds unless you were just general and said, the type of technique that we use is a low force technique. And that's what our staff tells clients who inquire over the phone. But that conversation with me in the exam room with that first time with a client is, have you had a chiropractic experience? And to Dr. Palmquist's point, what was that like? And some people are very, very forthright about, they for one reason or another, they had a good or bad experience. And then I just lead them through, well, this is what I do and this is how I do it. And it's not going to be uncomfortable, and the technique is a very low force. It won't look any different than when I just performed my examination, and it's not going to cause any discomfort. I can say that with a lot of confidence this many years out, but I was real nervous when I first got certified, of course, that I was going to cause some discomfort, because we never want that for our patients, and it never really happened, but it was always something in the back of my mind. And now I know that these techniques that I'm using, I'm very confident that we're not going to see any sort of secondary effects from the treatment, but it's all about communication and expectation.
The other day I was out with a friend of mine's horse, and the reverberating pain from an old injury in the neck was so unbelievable. And then it locked up the rest of the back, and she had wondered why she got bucked off. And for me, that was pretty evident. And the first thing we did was call our chiropractor, and I'm going to meet with him and, be there when she gets her horse worked on. So for me, chiropractic ends up being so important, even from an emotional or behavioral standpoint.
My first question was, how do you perform chiropractic on a horse, though? That's impressive to me.
Short people need a lot.
Standing on stools.
I do actually. There's definitely a lot of undiagnosed pain. I can see it in a lot of I'd say at least half of my clients. I find something that seems like there's some limitation or some consideration or movement issue. And I'm pretty close with a facility here called the Wellness Center of OC. And they have a lot of these specialties like you're talking about. And they actually have a chiropractor or two that go there, and they work in the pool. So they have water chiropractic, and that seems to be really beneficial for a lot of dogs. I've yet to experience it with any of my pets, but the vet seems to be very successful, at least from what I've spoken to him and the people there. I'd be interested to probably do that in the future with my pets, as they're all becoming, 13 years old this year, and do have some, from what I can tell, some kind of pain or discomfort, and I can't really identify exactly what it is because it seems to come and go. So that's kind of something I'm interested in these, immediately, is like to figure out how can I communicate with them? How can I work with them? And it's subtle, very subtle, and I'd like to see, my question is going to be, what can we do at home? We're not going to be teaching everybody chiropractic at home, but are there things that are safe to do with our pets that could help us, that are pseudo chiropractic or very soft, like things like that? Obviously we can learn massage, but if these are fairly, low impact, is there anything safe that we can do with our pets that you would even advise or not?
Yeah, I think certainly massage is a great technique, and we teach our clients to do that all the time at home. And as far as the chiropractic goes, a bigger thing might be for us to instruct clients on how to do stretches and look for problems, treat stretches where they may come and get a treat from around each shoulder, down in between their front legs, so that they can pick up problems as they occur and give us more diagnostic information. So I think, the massaging along with some of those stretches, and then of course, with a lot of our behavior patients, we see a lot of chiropractic issues because perhaps they've been on a choke chain or, been corrected a lot, and it can cause a lot of upper cervical problems.
Let's talk about that. Yeah, let's talk about that restraint methods and training methods and how those can actually lead to harm. I think that's actually really important.
All pets respond to soothing touch, but they can't always tell us how much it hurts. That's why treating them at home with LumaSoothe 2 is priceless. LumaSoothe 2 puts advanced light therapy in the palm of your hand. This safe, non-invasive treatment relieves arthritis, back pain, and general deep inflammation, along with skin injuries and regrowing hair. 2 simple modes provide comforting care that works naturally with your vet's advice. Visit lumasoothe.com for the light therapy that feels like love.
Yeah, I think that's something that it's one of the main reasons I've leaned, I've steered towards a force-free practice as much as possible with my clients, my pet, and the dogs that I train and work with. Because I've been doing this for a little over a decade, probably 13 years now. And I know in the first several years, I didn't have the understanding and appreciation for how sensitive the animals are, not only in their cervical area, but, in this area here. And a harness can be just as damaging, or a face harness, as a choke chain or a prong collar. And there's a lot of controversy from where I come from of what's really safe and what's best. And a lot of misunderstanding. There's a lot of promotion of prong collars or pinch collars because there's a sect of people that believe that it's safer and doesn't cause cervical damage. And I'm just shocked to hear that. It's something that I see all the time. And I do my best to try to remove that kind of pressure from dogs not for other reasons, but also for the acute impact on the neck. I don't think any tool is designed to train your dog, first of all. So I have to have that conversation that the tools we use are not going to change the behavior alone. And so to not really focus on those, they're to make it easier to control your dog while you're training is my philosophy, so that it doesn't put so much strain on you. It doesn't cause so much frustration or emotional discomfort for the pet, or physical discomfort, and allows them to pay more attention to what really matters in the training scenario. So they're able to appreciate, their surroundings better, what I'm offering them better. They're not feeling trapped as much. So all these things benefit the training more than the actual device. It really is to make sure that I can hang on to the dog. They're not having extra distress. They're not hurting themselves over time. And so whatever method, I generally recommend a harness for most dogs, but I'll go with different types of flat collars as long as the dog isn't a problem, isn't pulling, or will transition into a harness because the harness is too much for that pet, or they have an aversion to it. My main goal is to make sure that they're happy and comfortable first. In my practice, I never suggest any kind of prong, any choke, any electric collars. Anything that constricts the neck, the blood vessels, the thyroid is right there too. There's a lot of nerves. And so I'm trying to get everything off the neck if I can. But there's a lot of bad harnesses out there that really constrict the movement here in the shoulders. They actually kind of push them together. A very popular brand actually does this. And I believe, from what I can tell, it causes a lot of tension up here over time. And so I'm looking for one that allows more range of motion for the pet. And in some cases has 2 points of contact for the dogs who struggle. So it helps kind of divert or move the pressure around the body versus so directional in one point that's kind of how I look at it.
It's a very frustrating problem because, I'm sure you guys will appreciate, you get these dogs with neck pain or have disc problems, confirmed disc problems, and they come back from the neurologist or even just the emergency clinic, and they've said they should never wear a collar again. They should wear a harness. And I agree, that one size doesn't fit all. I mean, just saying put them in a harness doesn't really help, because we can get some really adverse pressure in that cervical area, probably in some dogs worse than a collar. Depending on their behavior and how it fits. So I wish I had a favorite, but I'm going to agree that it's an individual case thing. It's almost too frustrating because you wish you could go back in time and have the dog just behave better when it's wearing a collar or harness. But there's just so much trial and error and just paying attention to what the dog's issue is, where the pressure is in their body size, and what kind of tack they're wearing. And
a lot of people even if they know about chiropractic, think it's only good for musculoskeletal problems, that it's when their dogs are limping or they have a sore back. And that's how they think about it for themselves as well as people. And yet a colleague of mine who does homeopathy, acupuncture, and chiropractic had a dog come in with bladder issues. And the dog came in for homeopathic treatment. And the dog was like straining almost constantly. And she started by doing a chiropractic adjustment. And within 15 minutes after doing the chiropractic adjustment, while she started getting more information about the dog's history, the dog stopped straining. And so they did not give a homeopathic medicine, and the whole issue was completely resolved. So can you give us some examples of why should people go to a chiropractor? What can be helped? And not just musculoskeletal, Dr. Neal.
You bet. When you take the chiropractic training, a lot of times people will go, you go around the room and everybody will say, what prompted them to take the course or think about the study. And amongst the veterinarians, it's at least when I went through the training, it was a common answer to say urinary incontinence or urinary leaking, especially after female dogs were spayed. Having surgery, having the anesthesia, their normal muscular protective mechanisms are eliminated during anesthesia. And so it allows that spine to maybe do some things that it wouldn't normally do. And those dogs come off the table and start to leak urine. And that's something that chiropractic can really come in. And if we find a chiropractic issue that can, much like your example, it can fix it immediately. So that's something that I've seen numerous times, and a lot of veterinarians who see those post surgical patients will see. Probably another area where we're affecting the whole nervous system with chiropractic. So there a potential, everyone that walks through the door is a chiropractic patient, but certainly the urinary tract issues, the digestive issues are huge. Where we've got chronic stomach upset, or especially chronic diarrhea, where they may have a lot of times they'll have chiropractic issues, and we correct those and we can see some resolution of the problem.
About how many times have you seen like emotional release from chiropractic?
Oh, absolutely, all the time. So, I guess Christina, the bottom line is who's a potential patient? Everybody. Until we lay our hands on them and actually give them a chiropractic exam, we should, at least in my office, that's on the table. We're gonna make sure that everybody is free of chiropractic issues before we move forward.
So I think that is critically important for all of our viewers to know. If you can find a chiropractor near you, and that's your next question, Dr. Neal, is how to find one. If there's a chiropractor near you, have them do an annual exam. If it's a regular chiropractor, you need to go to your conventional vet for the veterinary exam. But if at least once a year you're going to a chiropractor, and if you can, then that's going to help prevent problems and correct early problems. The second thing is, if your veterinarian is trained in chiropractic, then any illness, go in and do chiropractic first, because thinking of it from a sustainability aspect, how much what's the carbon footprint of chiropractic? Zero. Once you're trained, your hands are doing it. You might use an activator or something, but you can do it just with your hands. So from a sustainability standpoint, chiropractic would be the one to reach for first. And you've got people with professional training for that. And definitely it cures behavior issues.
But I want to hear that. Yeah, I want to hear what he has to say about the emotional stuff. I think that's really important. In people, it's really common when people get adjustments to start crying or to start laughing or to have emotional releases. What do you see with dogs and cats and horses?
Well, we get those patients, especially the first time they're in the exam room, and they're nervous about being in a new place, and maybe they've got chronic pain or other sort of medical issues, and we can get that adjustment done, and we see them relax, and that calmness, and just the tension leaving, and that anxiety really decreasing.
And is there anything better than when they turn around and say thank you?
No, nothing.
And I want to go to the sustainability of the animal itself. If people knew to do chiropractic adjustments early on, they'd be preventing further, decline, as an animal kind of dwindles, and the old accidents tend to become the, chronic pain for the animals. And so if you're following through with chiropractic, everybody here, even my cats, get chiropractic. So my dogs, cats, and horses all get it. And it's amazing because, especially if you have really active animals, they should always get seen. The hikes I do and the crazy acrobatics that my dogs do, they need, so I feel like everybody's a candidate for it. Whether you have an active life or you've had an accident or you've had a surgery, because as quadrupedals, they're going to be moving differently. So I think sustainability of an animal's life is start doing it early.
Can you explain how chronic pain develops, how that, like the original injury and the pain can manifest as chronic pain? Can you talk about that? Yeah.
You bet. Yeah. I should emphasize, like Joan was saying first, though, that, those old traumas get stored in the tissue. And so, and whether it be emotional or physical. And so, yes, we've got all of those old injuries to maybe contend with when we're treating a patient. But, they perhaps get that. We can look at a primary back problem where they have inflamed discs or they have arthritis, and that those sensations go to the brain. And if those are continuing, then they can cycle and build up on each other, and we get into a self-perpetuating loop where we need either medications in the case of traditional practice, or our natural therapies in the case of our practice to break that cycle. And it doesn't necessarily have to be a back issue. It can be, we'll see certainly a lot of patients that have, thinking of our dog patients, they may have a knee injury, a cruciate ligament injury, which is very common in our patients. And that's a twofold issue. They've got the pain in that particular limb, plus, for instance, if it were a left knee that is uncomfortable, then they're leaning to the right, and they're creating stress not only in the right leg, but they're creating stress all up the spine because their posture is affected. And once those loops get started, it's very difficult. So Joan had mentioned, and again, that being preemptive is the best thing. So my practice, we see a lot of geriatric pets. So those pets present a lot of times later in life, but over the course of my time doing this work, now we're dealing with families that have gone through their second or third pet, and we have the benefit of them knowing that the sooner the better. So we'll see some of those patients earlier in their life for maintenance. Again, Christina, for that exam, to make sure that things are going well. If they've got a pre-existing condition, or if they're a working animal, whether that be a sport animal or they're a therapy dog or something like that, they know that there may be things that happen. Again, like Joan mentioned, where they might have jumping down or having accidents that we may need to see them more often. So we get to establish that schedule so that we're not so behind the 8-ball when it comes to that chronic pain. We can catch it before it gets started. And at least with the insurance companies that we deal with, it depends on the policy. And some insurance companies will require that the doctor be certified, which I think is a good thing. We shouldn't have veterinarians who aren't trained in chiropractic doing chiropractic and charging for it, as much as I feel like we shouldn't have doctors of chiropractic that work on people working on animals if they haven't been trained in animals. We used to see a lot of that when I first got started with awareness over time and the expansion of training programs. We see more and more chiropractors that are trained to work on animals, and I think that's a good thing. And the awareness amongst the public and veterinarians and chiropractors that this training exists. And depending on the legalities of the state, some states don't allow non-veterinarians to do chiropractic. Some do under various circumstances. And so each state is different that way, but that'll affect insurance payment for sure.
You need to ask your insurance company, not just do they pay for chiropractic, but are there limitations, because some of the insurance companies will only pay for 1 or 2 visits, or you need to know what the actual criteria of your individual policy that you're potentially buying or have is. And a lot of companies, when you say, do you pay for alternative medicine? They'll say yes. But then when you actually dig in, you find out they only pay for 2 acupuncture treatments. And, so you need to know what you're buying.
Patients are, our animal patients are a lot more forgiving, cats being the best chiropractic patient on the planet, I think, because they're so limber. But, a lot of humans, when they start to go, they may need to go 2-3 times a week. And so it would depend on the pet's age and their medical condition. And the doctor's technique. So the technique that I use tend to hold their adjustments a little longer, and that comes with experience. I wanted to see those patients back a lot more when I first started, but I'm also doing nutritional counseling, and we're doing acupuncture. And we're having the clients do massage at home. So it's that whole mix of things. I've got a pretty good sense now of what kind of cases need to come back more often. Sometimes it's in a week, sometimes it's in 3 weeks or a month. And then when we have those maintenance patients, like Christina said, we'll see some annually, but I like to see them, depending, every 3 to 6 months. Both of you are certainly familiar with the American Holistic Veterinary Medical Association, and so veterinarians can be a member of that group. They can list their activities by modality, so you can, a client could go to the ahvma.org website and do a practitioner search and look for veterinarian there. We should say that the best option, of course, would be if you talk to your primary care veterinarian and they have a relationship with someone.
Unlock the secrets to your pet's wellness with Dr. William L. Schmidt's A Pet Owner's Guide to Animal Chiropractic. Learn to spot and address structural issues early during routine walks with your dog or horse warm-ups. This comprehensive guide provides step-by-step AVCA certified chiropractic techniques to keep your pets healthy and active. Don't wait for small problems to become big ones. Grab your copy of A Pet Owner's Guide to Animal Chiropractic on Amazon or drwilliamlschmidt.com.
The sooner that we can see those pets in their life for routine care and establish a maintenance plan, the improved quality of life they're going to have, and we're going to head off future incidents of illness, of lameness, and we're going to just have them have a healthier, happier life. And so it may seem like your pet has, from the outside, is functioning just fine, but if we can remove those chiropractic issues, your pet will experience a much healthier life and have fewer health problems. We'll have a lot of clients whose pets maybe come and have some trouble, and all of a sudden they can't do those things that they used to do. We don't want them to, jumping off the bed. And now that Lulu knows how to use steps already, you've already headed off that potential issue. So that's wonderful.
Well, and chiropractic and yoga go together. And I know she's been doing yoga. So, sometimes you need to get an adjustment to optimize your yoga practice.
Thank you so much, Dr. Sivula, and thank you to our panel for this amazing show. Doctor, is there a way for our viewers to find out more about you?
Sure. Our website is dancingpawsawc.com.
Medical information obtained from our website or the live show is not intended to be a substitute for professional care. If your pet has or you suspect they might have an illness or other medical condition, you should consult a healthcare provider. The opinions expressed on this TV program are not necessarily those of Smart Pet Talk, this TV show, or their sponsors. For all questions or info on sponsorship, email us at info@smartpettalk.com or visit our website at smartpettalk.com.